There are more than 400 million patients worldwide with rare diseases. That is more than all the patients with cancer. And yet, the number of therapies, the ability to diagnose effectively, the suitability of healthcare systems, the policies to support further innovation and research are still just at their outset.
So rare diseases have been defined differently in different scenarios. In the US, the way we define rare diseases based on the incidence. Something that is less than 100,000 patients per population is called a rare disease. Now, something that is rare in one country could be completely not rare at all in another country. A classic example for that is thalassemia. Thalassemia is a rare disease of largely immigrant population in the United States. But if you look at a country like India, thalassemia is very common, or a lot of Middle Eastern countries have a lot of thalassemia. The challenge with the rare disease is that because they are limited in number, the resources around that, be it on the clinical care, be it towards advocacy or research, are very limited. And that is where we have to pool the rare diseases together to be able to build those resources.
On the occasion of Rare Disease Day, I am most excited about the potential of US-India strategic cooperation to make cell and gene therapies most affordable for all patients in US, India, and globally. I think combining the entrepreneurial innovation of the United States and the chemistry manufacturing controls capabilities of India is offering new hope for patients with rare diseases.
The reason for high number of rare genetic diseases in India is because of the family structure, particularly following consanguinity and also following the endogamy, means marrying within the group. Particularly in South India, Tamil Nadu and Andhra Pradesh or Telangana particularly. So there is a culture that the uncle-niece marriage is more common, or first cousin marriage is even more common.
There is very strong hope on the horizon because we have so much more information today. With genomic advances, we know what is the problem on the genetic level in these rare diseases, and knowing that, we can design therapies for rare diseases.
We are on the cusp of a lot of evolving technology and science and public policies that are merging together to offer a lot of unheard of and unavailable therapies that could benefit the rare disease population.
More companies started coming forward to develop drugs for rare diseases, and as a result, now we have about treatments, lot more treatments than we had historically, but still only 5% of the rare diseases have treatments, and we have 11,000 of such diseases. So there is immense need for new treatments, and with that, FDA has come up with a lot of flexibility in approving drugs for rare diseases.
As Rare Disease Day approaches for the upcoming year, areas of focus that can be celebrated and committed to during that time are to the patients, to progress, and to have an open mind, to be creative and clever as we move forward with treatments for the patients and families in need.
Hi, my name is Anil Raina. Have been working in India in the rare disease space for almost 17 years now. I would say I'm probably be the oldest person in the rare disease space from an industry point of view in India. Have done a lot of work in creating the ecosystem, RD ecosystem in India from a time when there was nothing really which was existing in India. Incidentally, I'm also a patient who has a rare disease. A person who has a rare disease should never lose hope, and nor should the caregivers of that patient. I would urge all the patients or all people who are suffering from different kinds of rare diseases not to lose hope.